call me on the internet the Green Smoothie Girl. And I don't know if you know, but I've been traveling all over the world studying non-toxic cancer treatment for about a year and a half now. And I've been to clinics all over several continents. And I've started to notice a theme that we all have cancer patients around us, and we don't know how to interact with them. And picking this up from the patients, I started to ask them at various clinics, what do I do when I interact with you? Because I think that my readers would like to know, since 1 out of 2 men gets cancer currently, and more than 1 out of 3 women, we're all facing this all the time. And these cancer patients talked a lot about their frustrations, about the things that people say and do. So I thought I would share with you how to interact with a cancer patient. This is the consensus after interviewing quite a lot of people and then testing my hypothesis out with them as I got more data about it. Okay, so number 1, this is what the cancer patients tell me. Number 1, these are the don'ts, things don't do with your friend who's been diagnosed with cancer. First of all, don't avoid them. You find out they're diagnosed, the worst thing we can do is just not talk to them or not talk to them about it. Number 2, don't give them that voice and that face. Do you know what I'm talking about? You know the voice and the face? Okay, well, I will do it for you here. Okay, ready? Hi, how are you? Okay? You know the voice and the face now, right? Okay, it's coming from a good place. We're trying to express what that voice and that face are concerned, but what it comes across as is pity, and it's scary to a cancer patient. And what they said is they hate that. And so I think I'm going to give you better examples in a minute, but don't do that. It makes them feel pity. The cancer patient doesn't want to feel negativity or pity, which brings us to number 3, things not to do. Number 3 is don't talk about negative outcomes. Don't talk about someone you've lost who had a cancer diagnosis. This is not what they want to hear. Let's talk about the do's. I got 4 of them. The first thing cancer patients tell me is do be around me. Act normal. Talk about normal stuff. Talk about the same stuff that we talked about before I got diagnosed with cancer. I don't want to think about cancer all the time. Number 2, laugh with me. Anything you can do to tell me a story, to interact with me, it makes me feel more normal, is positive. Make it sunshiny, make it light. Number 3, tell me positive things. Tell me about people you know who've beaten this. Act like it's a thing you got. You got this thing. Talk about the positive angles, the things they've been doing that are disease preventative. Where can you go that doesn't go to pity and doesn't go to negativity? And number 4, if you're not sure about how to talk to a cancer patient, ask them. Say, what do you need from me? How can I best support you? I think that's sometimes the last question that we think of, but how helpful is that? And they can tell you. And then you do it. So I heard these answers over and over again. I think that there are things that you can take to the bank. I hope this has been helpful. If you're a cancer patient and you're seeing this video, chime in and tell us if I'm right or I'm wrong and add to it. I'm Green Smoothie Girl. See you next time.